Hey guys, it's Dr. Heyer from Holistic Health. Today is Thursday, March 1st. We've got through the winter months. We're done with February. If only it was shining, but it's still warm. It's nicer than it was. Hey guys, had an interesting conversation the other day with a patient and it kind of stuck in the back of my head. You know, sometimes people will come to me and they'll say they're complaining of their back pain or their shoulder or their hips or what have you. And I'll ask them other questions and it kind of throws me for a loop when I ask them things like, based on what you're describing with your neck or your shoulder or your back pain, do you ever have any headaches? And they'll say, well, yeah, I have headaches. I'll ask them, well, how often do you have headaches? Oh, I have headaches every day. And if you look at the paperwork, they never put anything down on their paperwork. They never mentioned anything in their consultation about headaches. And yet, this person may have had headaches for how long? Oh gosh, doc, I've had headaches for years. Isn't that common? Everybody has headaches. I have the common headache. Well, I want to start breaking the mind patterns that people have that something is common, which means that it's okay and it's normal. Common does not equal normal. A headache is not normal. A headache is your body's alert alarm system telling you something's not right, buddy. Get it checked out. And kind of a rule of thumb that I tell patients is if you're experiencing an ache or a pain or a headache of some type that lasts for more than a week or two, that's your body's way of saying, please check me out. Please look into it deeper. And there are some common things I hear from patients that they kind of try to dismiss and kind of belittle in their world. Things like headaches, yes, of course. Sinus congestion. If you're having chronic sinus congestion, there's something not right that needs to be looked into. Aches and pains. Well, doc, I've got the normal aches and pains everybody else has. Again, it's an alarm going off telling you to get something checked. Difficulty sleeping. If you're not sleeping well, that's not good. There's something wrong that's keeping you from getting that restorative, regenerative deep sleep. But doc, isn't arthritis normal? Well, maybe in some families, but the problem is if there's an arthritic joint or arthritic spine or arthritic bone, that's your body is telling you that there's been a long-term arthritic or inflammatory issue or degenerative issue that was never checked. It could have been from an injury 2, 3, 4 years ago, 20 years ago. And of course, digestive issues. Those get downplayed a lot because we like to pop Tums and take antacids to mitigate the symptoms, but not really get to the underlying cause. So, my thought for you today is to take a look at your life and say, what are the common issues or ailments that affect me, and what am I going to do about them? Because if I want to have a great 2018, I may have to actually take some action and start focusing on improving myself and as well as my health. Okay, thanks. Just a thought for you today. Have a great day.